Hello friends, I am Dr. Ashutosh Shukla. I am the medical advisor and senior director internal medicine at Max Hospital, Gurgaon. And today I am going to talk to you about hypertension, that is high blood pressure. Blood pressure is a silent killer because if it is persistent and raised for some time, when we don't realize it, it can lead to harm, it can cause heart attacks, it can cause strokes. Hence, it's a very important disease. So let us understand what is high blood pressure. We all have a circulatory system and we have small little arteries which are carrying oxygenated blood from the heart to all the tissues and the peripheral sites in our body. What happens in high blood pressure is that the pressure with which the heart pumps causes damage to these tiny blood vessels over a period of time, and that results in conditions like heart attack and stroke. So there are two types of blood pressures. The upper blood pressure, which is the pressure recorded at the time when the heart is contracting at its peak, and in between each beat of the heart, the pressure which is recorded is known as the diastolic blood pressure. So high blood pressure or hypertension, in urban India, 1 out of every 4 adults has hypertension. Up till the age of 45 years, men suffer more often high blood pressure. After 45 years to 60 years of age, the prevalence between men and women is more or less the same. And beyond 60 years of age, women tend to suffer from high blood pressure more often. So the causes of blood pressure can be categorized into two different types. Blood pressure or hypertension can be of two types. First is the essential hypertension, which is when the onset of blood pressure happens beyond the age of 40 years. Whereas if the onset of blood pressure happens at an age less than 40 years, this is known as the secondary hypertension. And the causes for both these conditions are different. Like if the onset of blood pressure is happening at an age less than 40 years, the common causes are like diabetes, aneurysms of the heart, pheochromocytoma, kidney disease. So these are the conditions which need aggressive testing. Whereas if the onset of blood pressure is happening at an age beyond 40 years of age, that is essential hypertension, there it is primarily because of age, or it could be genetics. In fact, 30 to 50% of your genetics contributes to causing high blood pressure. Lifestyle conditions like, if you are taking alcohol on a daily basis, or if you are a smoker, you have high chances of having high blood pressure. In your diet, if you have high intake of salt, then you have high chances of having high blood pressure. Some people who have elevated stress levels for a prolonged period of time, or who are very anxious and have constant racing thoughts and have a worrying nature, they can also develop high blood pressure, and many times it goes unnoticed. Most people with high blood pressure have no symptoms or signs of high blood pressure, and it goes undetected and undiagnosed. But some people with high blood pressure do get headache, dizziness, and some people land up with a nosebleed when they have high blood pressure. And rarely some people may have blurry vision, they may have vertigo, dizziness and nausea because of the high blood pressure. When you ignore your blood pressure, which is high, it can cause certain complications like heart attack, stroke, or it can even cause rhythm disturbance of the heart, which is known as arrhythmia. And some people with elevated blood pressure can land up with a kidney failure. So other than that, there are certain dilatation of the major arteries like the aorta, which is coming out from the heart, or the main artery which is supplying the kidney, that also dilates and causes a condition which we call as aneurysm, and which has a likely chance of rupture. So these are more dangerous complications of high blood pressure. So high blood pressure is said to happen when your blood pressure recording is above 130/80. And why was this cutoff decided? Was because people who had blood pressure above 130/80 had much higher chances of landing up with problems and complications because of the elevated blood pressure. So when you are recording your blood pressure at home, there are precautions to be taken to avoid errors. Before recording the blood pressure, you should avoid having alcohol or smoking a cigarette or having any drink which has caffeine. And once you sit down, rest for about 5 minutes and then tie the cuff on the upper arm. And whenever you tie the cuff, blood pressure cuff on the arm, it should be so tight that 2 fingers can be inserted below the cuff, and the cuff should not be too tight and it should not be too loose. And the cuff should be about 2 inches above the elbow. And the instrument, the blood pressure instrument, should be approximately at the level of your heart so that there's no error. So you can prevent high blood pressure by leading a healthy lifestyle. And by healthy lifestyle, I mean having a good balanced nutritious diet, which comprises of low fat diet plus controlled salt intake. Your salt intake should be approximately 5 grams or 1 teaspoon in the entire day. Try and avoid alcohol and cut back on your smoking. That also has a definite direct correlation with your blood pressure levels. Additionally, your stress and anxiety levels can cause elevated blood pressure. So try practicing 15 to 20 minutes of meditation every day. That will help control your blood pressure. Plus the quality of your sleep. 7-8 hours of sound uninterrupted sleep goes a long way in controlling your blood pressure. So treatment of blood pressure depends upon the category. Either it is mild, moderate or severe. So if you have a mild elevation of your blood pressure, maybe initially you can start changing your lifestyle and watch your blood pressure twice a week. But if you have moderate or severely elevated blood pressure, definitely you need to start medications and also change your lifestyle and cut back on the salt intake. But do keep checking your blood pressure at least twice a week, if not thrice a week. And please be regular with your blood pressure medications and do consult your physician, because there are so many drug interactions with other drugs you may be taking. So avoid self-medication and be in touch with your physician.